Welcome to this presentation on ghrelin. Ghrelin, a 28 amino acid peptide hormone discovered in 1999 and quickly dubbed the hunger hormone for its ability to increase appetite and food intake. Synthesized and secreted by gastric parietal cells located in the stomach's mucosa layer, the layer located just below the surface of the lamina propria. The largest factor regulating ghrelin secretion is food intake. Ghrelin surges prior to a meal and quickly falls soon after. Whilst ghrelin secretion is largely regulated by the enteric nervous system, which operates autonomously of the central nervous system, the autonomic branch of the central nervous system does play its part. Secretion of the hunger hormone is largely regulated by a balance in the ENS between the cholinergic receptors of the parasympathetic branch, stimulated by neurotransmitter acetylcholine, and adrenergic receptors of the sympathetic branch, stimulated by neurotransmitters norepinephrine and epinephrine. After we eat a meal, blood glucose levels rise, which in turn stimulates insulin release. Insulin then acts on the receptors in the hypothalamus to turn off the need to eat. As blood glucose levels fall, ghrelin is secreted into the bloodstream, which stimulates activity of neuropeptide Y and NGRP neurons located in the hypothalamus. Activation of these neurons send a signal via the CNS vagus nerve to the stomach in the ENS, and a person experiences the feeling of hunger. Probably the largest effect ghrelin has on another hormone system is its interaction with growth hormone. Ghrelin enters the hypothalamus and binds to its receptor, growth hormone secretagogue receptor. Ghrelin activity can only be exerted on this receptor once an acyl group is added to the serine 3 of ghrelin. Acylation occurs due to an enzyme called ghrelin O-acyl transferase, or GOAT. So how does ghrelin do this? Well, the ghrelin receptor is a G-coupled protein receptor. When a ligand, in this case ghrelin, binds to the receptor, the ion channels open, and the receptor promotes the secretion of growth hormone releasing hormone in the hypothalamus. GHRH then travels through the circulation network to the anterior pituitary gland, which then secretes growth hormone into circulation. Now let's look at the interaction between ghrelin and leptin, leptin being the hormone that tells us we're full. Over the years, the ghrelinnergic system has received much attention in an attempt to treat obesity and overweight by reducing appetite or increasing appetite in people with anorexia or malnutrition. However, results have been inconsistent, and ghrelin has not been shown to directly cause obesity. Unexpectedly, people who are overweight or obese actually have lower levels of ghrelin compared to leptin. However, it's been hypothesized that they may be more sensitive to the hormone, and even small fluctuations will cause an increase in appetite. Ghrelin levels also seem to increase after dieting, making sustainable weight loss difficult. Now let's take a look at insulin and ghrelin. Ghrelin receptors are expressed in alpha and beta pancreatic cells of the pancreas. Therefore, the secretion of ghrelin indirectly acts on the pancreatic islets and modulates the secretion of insulin. Insulin is an anabolic hormone which promotes glucose storage in the liver in the form of glycogen, as well as synthesis of fat, protein, and carbohydrates. Now let's look at ghrelin's target tissues and physiological actions. As ghrelin activates the receptor within the hypothalamus, this indirectly affects a number of peripheral tissues that also express the ghrelin receptor. Some of them include pancreatic cells, cardiac muscle, and the reproductive organs. Ghrelin receptors have been located in the heart and vascular system, and ghrelin has been shown to exert positive effects on the cardiovascular system. In a 2016 study, the hormone was shown to improve vascular function, decrease blood pressure, inhibit sympathetic input, and post-myocardial infarction reduce the frequency of arrhythmias and apoptosis. The improvements in heart health are attributed to decrease in vascular resistance and excessive sympathetic activation through the reduction of neurotransmitters norepinephrine and epinephrine. Ghrelin receptors have been expressed on gonadotropin-releasing hormone neurons. The hypothesis is that ghrelin actually reduces the release of this hormone from the hypothalamus and thus reduces the secretion of follicular stimulating hormone and luteinizing hormone from the anterior pituitary gland, and therefore indirectly affecting the reproductive system. Let's take a look now at ghrelin and a disease state known as Prader-Willi syndrome. Some characteristics of this syndrome include infantile hypotonia, developmental delay, feeding difficulties, and short stature. Common behavioural problems seen are temper outbursts, stubbornness, compulsive behaviour like picking at the skin. Prevalence is equal across both genders, male and female. Genitals are usually underdeveloped, puberty is often delayed, and females who are affected are usually infertile. The syndrome affects chromosome 15. Most people inherit 2 copies of chromosome 15, a maternal copy and a paternal copy. In 70% of Prader-Willi syndrome cases, the cause is a segment of the paternal chromosome 15 being deleted. This segment being deleted means that the genes are not able to activate the maternal copy. In Prader-Willi syndrome, we see elevated levels of ghrelin, a condition known as hyperghrelinemia. Elevated levels of acylated ghrelin activate the ghrelin receptor. Elevated levels of this hormone in a person with Prader-Willi syndrome decreases their ability to control food intake and appetite and leads to excessive calorie consumption. Their decreased muscle mass further reduces their ability to increase their caloric expenditure, leading to a person with Prader-Willi syndrome becoming overweight or obese. Why did that stop?